or valve problem, any of which can prove fatal.
That was a big shock to us.
I was like, what? A heart condition? Nobody's even mentioned anything like that. It was terrifying. I pretty much could die any minute.
When I first met Jessica, she was very sick. Once bacteria is in the bloodstream, it's important to look at everywhere where you could possibly have infections. Certainly the heart is one of the areas where infections can hide.
Dr. Notoriani thinks he may know what's behind Jessica's mysterious decline. But to confirm his hunch, he needs to get a clear look at her heart.
A TE is a transesophageal echocardiogram, where we place an ultrasound probe at the end of a tube. That tube is then inserted into the esophagus and brought down to the stomach and to the level of the heart so that we can see the heart a lot more close up. The transesophageal echocardiogram confirmed the diagnosis of endocarditis.
Endocarditis is a life-threatening infection of the heart. In a healthy individual, when bacteria enters the bloodstream, the immune system fights it off. But in patients like Jessica, for unknown reasons, bacteria lodges on the valves in their heart. Blood then clots around the bacteria, forming a dense growth that antibiotics can't reach, which can lead to both sepsis and potentially fatal damage to the heart.
Once the vegetation is formed, the heart valve can then not open and close correctly. In addition, it can just start to destroy the actual structure of the valve, so the valve itself does not work the way it's supposed to work. A vegetation on a heart valve looks very much like a mushroom. There's a stalk with a round object at the top of the stalk. Usually they're mobile, and in her case, the measurement was a little over 1 centimeter in both directions.
I thought it was really insane that there was something growing inside my body on a vital organ. I was completely floored, but the fact that they finally found out what was wrong with me was a huge weight off my shoulders.
While Dr. Notoriani can't know for sure, he suspects that the disease started with a structural abnormality in Jessica's heart that she was never aware of.
On the transesophageal echocardiogram that was performed on Jessica, we did see mitral valve prolapse as part of her findings, and so she probably did have that before the infection started.
And once the infection entered her bloodstream and latched onto the valve, Jessica's immune system went into overdrive.
Your body's mechanisms for fighting infection include fevers. Raising the temperature is one way of killing off infections. Headaches would accompany that because of the body's attempt to fight the infection that's there.
While doctors tried to keep her symptoms in check with antibiotics, they only helped so much because they couldn't get to the source of her infection, the vegetation on her valve.
The clot also blocks blood flow to the center of the bacteria, and you need blood flow in order to get the antibodies in to kill off the bacteria.
Eventually, her infection escalated and became so severe that Jessica became dangerously septic.
The infection spread throughout the entire body.
And to make matters worse, as the bacterial growth on her heart mushroomed, it began tearing her mitral valve apart.
A torn valve in your heart leads to increased pressures in the top chamber of your heart, which can then force more pressure into your lungs and lead to complications. If Jessica's condition had not been eventually diagnosed, she would have developed congestive heart failure. She would then not have been able to breathe, and eventually her heart would have stopped.
I feel like I'm the luckiest person ever, because if they didn't find out when they did, I would have died.
With a massive growth of bacteria threatening to shut her heart down, it's imperative that Dr. Notoriani operate as soon as possible.
While prolonged antibiotics might be able to cure her infection, because of the size of her vegetation, it would need to be cut out. And because the valve was torn, it would need to be surgically repaired.
I never thought I would ever be 30 years old and have to go through open heart surgery. It was insane.
Unfortunately, the medical team can't perform the complicated surgery until they deal with an even more pressing issue, the sepsis that's flooding Jessica's bloodstream.
It is dangerous to operate on somebody who is septic. Their body is fighting the infection. It doesn't have the ability to recover as easily.
They couldn't perform the surgery right away because she had bacteria all throughout her system, and they needed to eliminate that before they did open heart surgery.
In a race against time, Dr. Notoriani immediately doubles Jessica's dose of antibiotics, hoping to eliminate the infection before her valve literally blows out.
To be told that your body is a ticking time bomb, that your body is essentially working against itself, it scared the hell out of me.
I was absolutely terrified. It's just an awful feeling knowing that at any moment she could lose her life.
Jessica Blazak has just learned that a bacterial growth on her heart valve has been damaging her heart and poisoning her bloodstream over the past 3 months. Now, she's undergoing a course of antibiotics to combat the lethal infection so that surgeons can operate. But at any given moment, her valve could collapse.
After 3 days of being on the antibiotics, Jessica was finally cleared for the surgery.
I was very scared something would go wrong and I would never wake up from this kind of surgery.
I felt very helpless when she was being wheeled into surgery. At that point, there's nothing that I could do. It's all in the hands of the doctors. Pray for the best.
Once the surgeons gain access to the heart valve itself, the mass is actually just cut out with a scalpel. And then the mitral valve was sutured back together again.
After 6 grueling hours, the surgeon pronounces the operation a success.
They were able to remove the bacteria to save her valve. It was a huge relief knowing that the surgery went well.
When I woke up, I was fine. Thank God.
Jessica was able to go home about a week after the surgery.
I had to be on antibiotics for a month to make sure that all of the bacteria was out of my system.
Jessica's prognosis now is excellent. She has recovered completely from the surgery.
I didn't sustain any lasting damage. My heart is completely back to normal.
Thrilled as she is to be alive and healthy, Jessica can't help but wonder why it took so long to get a solid diagnosis.
In retrospect, endocarditis is something that is detectable. It's very frustrating to think about how come so many experts miss the diagnosis. I had all the textbook signs of endocarditis, but nobody noticed.
She is very atypical in that she did not have any of the usual risk factors that we knew of. Diagnosing endocarditis is tricky because of the presentation. Fevers can be caused by lots of different things.
I don't think it's anybody's fault. I just think that I'm lucky to be here. And I appreciate the fact that somebody found it.
Today, Jessica is symptom-free and as active as ever.
She's back to living a very normal, healthy lifestyle, but she is definitely still at high risk for developing endocarditis again in the future. She needs to take antibiotic before she does any type of procedures that could possibly introduce bacteria back into her bloodstream.
I feel fantastic. I feel like I'm finally back to myself. It's been 3 years since the surgery, and I have a healthy heart.
She was extremely brave and courageous for everything that she went through, and I care about her very much.
I think you have to really listen to your body. If you feel sick, if you feel something is wrong, follow up with it, because it might be something serious. You might not be able to sleep it off.
I think Jessica's story says a lot about advocating for your own care. You should trust your instincts and your body and really follow up with your doctors on what is bothering you.
I think the biggest lesson that I've learned is to really live your life, to really, go out there and make the best out of everything you have. I'm just so unbelievably lucky. I thank God every day that I made it through, and I made it through healthy.
While Jessica Blazak went to the doctor soon after her symptoms first set in, Jake Tate ignored an onslaught of bizarre growths until a crisis forced him to face the horrifying truth. In August of 2006, 20-year-old Jake Tate, a one-time star basketball player, was focused on winning something bigger than a game: the girl of his dreams.
Heidi and I met at a restaurant we were both working at in Knoxville. I knew she was the one.
Jake was very athletic. He's a very good-looking guy. He's 6'6", and he has one of the most determined, hardworking natures, and he won't let anything stand in his way.
I asked to take her to dinner after work, and she introduced me to her son, Benjamin.
And when I saw how sweet he was with Ben, it was just immediate.
Heidi and I dated for 9 months before I proposed. We got married in Vegas on May 29th.
And almost as soon as they return from their honeymoon, Jake makes a momentous decision.
I knew that I had to have a better job to support my wife and child. So in June in 2007, I decided to join the Air Force to do tech school for meteorology. After basic training, I was stationed in Biloxi, Mississippi. It's kind of like really strict college. You go to class every day and you learn how to forecast meteorology. To think that you complete 2 years of college in 8.5 months is pretty crazy. I would wake up at 4 o'clock in the morning, get ready for school, and the day ends about 3 o'clock. And then you do PT till about 6. It's constant physical and mental strain.
Over the next several months, Jake slowly adapts to the demanding routine. He has no clue that his life is about to spin out of control.
I was in the shower and I noticed that I had a small lump that was the size of an eraser on a number 2 pencil. It was protruding from the right side of my abdomen. I thought maybe I hurt myself exercising. I just kind of thought it'll go away.
Putting the strange growth out of his mind, Jake throws himself into the training program harder than ever. But over the next month, a dozen more lumps begin to form on his abdomen.
The lumps were kind of like small marbles underneath my skin. If I just kind of put my finger on one, put a little pressure behind it, it caused me a lot of discomfort, a lot of pain.
I first noticed that there was something wrong with Jake when he was rubbing his side and making a face. And I could feel that there was definitely a hard knot underneath the skin. Almost felt like a cyst of some kind.
I thought, well, can't be that big a deal. It's probably stress or something, because this is the most stress that I'd ever felt in my life. And I just didn't really want to go to the doctor.
But as winter drags on, more and more painful lumps appear at an alarming rate.
By that time, I probably had about 40 lumps. To cope with the pain, I started using a heating pad at night. I also would take hot showers and hot baths, and it really helped.
It was important to me that Jake seek medical help because at this point, it was obvious that this was something that wasn't normal.
I really just didn't want to go to the doctor, and I was going to continue to do what I'd been doing, ignore them, because I was still so young and new in the Air Force, and I was afraid that something like this could possibly get me kicked out.
Determined to maintain his status in the Air Force, Jake focuses on his studies, and in the spring, he graduates with flying colors. Soon after, he lands his first military assignment.
I moved to South Carolina to Shaw Air Force Base to start my job as a meteorologist.
When we initially got to South Carolina, there seemed to be a pause in the symptoms.
It was a lot more warm and dry in South Carolina. The heat and the lack of humidity and the lack of stress as I had learned my job and I was doing well at it. And so I started feeling a lot better. The lumps would become smaller in size and they would hurt less.
We thought maybe it was just going to take care of itself at this point.
As the lumps seem to shrink with each passing day, Jake and Heidi breathe a huge sigh of relief. Unfortunately, the reprieve is short-lived.
In late October, early November, I was getting more lumps. On my back, my thighs, and my abdomen.
These symptoms that he was having came back as strong as they had ever been before we left, and for the most part worse.
At this point, we actually started counting. Heidi and I would go through and take a highlighter and mark each lump